Introduction. Phenylbutazone is a non-steroidal anti-inflammatory drug, NSAID, belonging to the pyrazolone class. It has strong anti-inflammatory, analgesic, and antipyretic properties. Due to its serious adverse effects, its use in humans is now very limited and restricted in many countries. 2. Drug class. NSAID, non-steroidal anti-inflammatory drug. Pyrazolone derivative. 3. Mechanism of action. Phenylbutazone works by inhibiting cyclooxygenase enzymes, COX-1 and COX-2. This inhibition reduces the synthesis of prostaglandins, which are responsible for pain, inflammation, fever. By lowering prostaglandin production, phenylbutazone reduces inflammation, pain, and swelling. 4. Uses. Human use, limited. Rheumatoid arthritis, severe cases. Ankylosing spondylitis. Acute gout, rarely used now. Veterinary use. Widely used in horses to treat musculoskeletal pain, laminitis, arthritis. 5. Dosage. Adults, historical human dosing. Initial dose, 300 to 600 mg/day in divided doses. Maintenance dose, 100 to 300 mg/day. Warning note, routine human use is discouraged due to toxicity. 6. Side effects. Phenylbutazone is associated with serious adverse effects, including gastrointestinal irritation, ulcers, bleeding, bone marrow suppression, agranulocytosis, aplastic anemia, fluid retention and edema, renal impairment, hepatotoxicity, skin reactions, rash, Stevens-Johnson syndrome. 7. Contraindications. Phenylbutazone should not be used in patients with blood dyscrasias, peptic ulcer disease, severe liver disease, severe kidney disease, heart failure, pregnancy and breastfeeding. 8. Drug interactions. Anticoagulants, e.g., warfarin, increased bleeding risk. Other NSAIDs, increased GI toxicity. Corticosteroids, higher risk of ulcers. Diuretics, reduced effectiveness. Antihypertensives, reduced blood pressure control. 9. Precautions and warnings. Regular blood count monitoring is required. Use lowest effective dose for shortest duration. Avoid alcohol. Elderly patients are at higher risk of toxicity. 10. Current status. Due to its life-threatening side effects, phenylbutazone has been withdrawn or restricted for human use in many countries. Replaced by safer NSAIDs, e.g., ibuprofen, naproxen. Continued mainly in veterinary medicine. 11. Summary. Phenylbutazone is a powerful NSAID with strong anti-inflammatory effects, but its high toxicity profile has limited its use in humans. Today, it is mostly reserved for veterinary applications, especially in horses.